Okay, well, we'll get started. It looks like we've got a few people calling in. Thank you for joining us today. My name is Tom Vincent. I work for Mountain Pacific Quality Health Foundation, and this is the office hours for the NHSN COVID-19 reporting module. For this session, I thought I'd spend just a little time at the start going over a couple things, but I want to allow as much time for questions, answers, discussion. My hope is that most everybody is has enrolled and is getting through things with success. I do know that some people still are having questions. We field a few questions through email. And I'm hopefully that through discussing the issues today that some people might still be having, that we can find some answers for you. So just a couple of things to start. I want to make everybody aware. Hopefully you received an email from NHSN. I believe this came out last Friday. They're having a data quality webinar on Wednesday, June 10th at 1 o'clock Eastern. This is to teach various data quality strategies to ensure the accuracy of your COVID-19 data that you submit to NHSN. It will include how to avoid common mistakes and how to identify data entry errors and how to fix some of those errors. So again, that's Wednesday, June 10th from 1 to 2 Eastern. Registration is required for this webinar. So the other thing I wanted to share with you just real quick to remind some people, I know some folks are still trying to get in touch with NHSN to get some questions answered, get some maybe some issues untangled. I would encourage you to visit this website at the CDC NHSN. It's filled with resources and information having to do with the COVID-19 module. As you scroll down, there's all kinds of information about enrollment. You can review some of the training that they recorded for you. Data entry for each of the 4 pathways information is located on here. So until NHSN gets back to you, which they are inundated, shall we say, with inquiries during this time. So it may take a little while, but hopefully you can find the answers either through these office hours or on this website. So that being said, I'd like to just open the time up for our callers. I know, again, some of you have questions, and if you're listening in and you have an answer, please feel free to speak up. Let us all learn from you as well. With that being said, I'll give the time over to you all.
Hey,
any
Tom,
questions about?
Tom?
Yes.
Can you hear me? This is Marcy. And I just wanted to ask a question. I know we have been in discussion earlier today, but we are getting several inquiries as to whether how can you tell if the information that you enter into the COVID module in NHSN is, like, what is the final step? I know that in the training and the links, I've looked at a few of those trainings, and it seems like you get to that calendar, and if you hit submit and you get the message that your information has been successfully saved, is that the final step? Because I know it talks about uploading into like a CSV file, but my interpretation was that uploading is if you want to upload and export data on your own. It doesn't necessarily mean it's part of the process.
Well, there's actually, and some of you can correct me if I'm wrong, but my understanding is there's actually more than one way to enter your data. You can enter the data right on the calendar, and you can go right into each of the pathways and enter your counts. And after you've completed one of the pathways, you know, each pathway, at the bottom of that sheet, you click save, and it will save your data. And for that pathway, then on the calendar, it will show as green. So you've completed it and you've gotten it entered. The other way that people can upload data is through a CSV file. You can download, and right on this website is one of the resources. I'll just go down here. You can download a form in CSV format. Here's one for the resident impact pathway. I believe that's the link. And you can fill this out. This is what the worksheet looks like when you fill it out, when you enter data on the calendar. I'm a little bit ahead of myself. This is one way you could collect your numbers and then go in and manually enter them into the calendar. Conversely, if I go down a little bit further, there's a CSV template. Apologies for the confusion here. And it downloads right to the bottom left of your screen. And when you open it, it's just your basic Excel template. And so you can enter in your collection date and all the numbers for each of the fields going across. You can do this for a week, and you know, as they said, some folks can upload their data every week. And you can take this file, and here in just a minute, I'll log into NHSN and just show you where that's at, just so you can get a visual. And you can actually just upload your data this way. And on the calendar, it will show green if you do it that way as well. And you should, again, receive that message that it was uploaded successfully. So there are two ways to enter your data. Does that answer your question? Let me just see if I can get into, excuse me. Sam's here. But did that answer your questions, Marcy?
It did. I was thinking there just was an additional step that you had to go through, but it sounds like after you save into those 4 modules and you get that green saying successfully submitted, you're finished. Or you can do the upload via the template. So I was just making sure, and like I said, we have had several questions. Is that the last step? Do I need to do something more? And it sounds like that is the final step, whichever way you decide to enter your information. So thank you.
That's my understanding. Is that, whoops, it's not liking my password here. That's my understanding, yes, is that that's it. Do you know anything else, anybody? Or?
Well, there is a comment in chat from Becky. So why would we utilize the spreadsheet option if the calendar option is easier? Yeah. What is the actual message that confirms your data was submitted and received?
It's just a personal preference, is my understanding. Some folks, you know, if you're like me, you really like working in Excel. You're comfortable in Excel, and you can, like I say, you can just save those spreadsheets into a little folder in your computer, and then when the day comes that you want to upload your data, it just uploads right into the module. So my understanding is just personal preference.
And then again, the actual message that confirms your data was submitted is just once you hit submit, it says your data was saved successfully.
Yes,
okay.
Yes. I can't enter my information and talk at the same time, in case you haven't noticed. But yes, that's my understanding.
So this is Maggie. I'll just talk while Tom gets in there. if we do the calendar option and you've entered your data and you saved it, you can also save the calendar data down into that Excel or CSV option. So you have it for your
Tom,
computer
stop.
for future resident reference.
Tom,
Yeah, so here,
this is Pam.
go ahead.
If you go up to the top, when you first came on, there were alerts. So can you screen up, see where the alerts are on the left-hand, no, on the blue, it says NHS Home Alerts dash, alerts is the first one. Click on that. When you first came on, there were alerts. And if
Okay.
there's alerts,
Yep.
like if there's insufficient, if you haven't put something in, it will show up right here. So try not to go all the way by that, but if you do, you can always check your alerts to see what data is missing.
Oh, that's good. See, I learned something new today. That's great.
Yeah.
Thank you for that.
You're welcome.
But on the data entry here, we have the COVID. This is the calendar that you're speaking of. If we click in the calendar, you can see that we have each of the 4 pathways up here where you can enter your numbers. And then after each one, you click save down in the bottom right-hand corner. And I'll go ahead and do this. I've got a sample. This is a sandbox that I can play in. Not all of you will have this, so I'm just going to enter some numbers just for conversation. Let's say we have 2 confirmed. I'm just adding numbers. No deaths. We're going to be optimistic here. I guess let's go 5. And then I'm going to save. Okay, we got an error. Where's my error? Oops, let's do this. We had 2 confirmed residents. Total deaths 0, 19. That should be it, shouldn't it? Okay. Now, if we look up on the calendar, you can see that we have green for those 2 pathways, which should tell me that my data is complete for those 2 pathways. And we'll check our alerts. We have no action items, so that's a good thing. If I didn't fill out all the numbers, I would have this beige color saying my record was incomplete. So that's one way of entering your data. The other is the CSV template, which you can just upload right here. And I think I still have one saved. I'm going to go look here. I mocked one up not too long ago, just for such an occasion. Not there. But you literally find your, find where you, just a note, keep track of where you save stuff. You literally find your data sheet and click upload and you're done. So it's another easy way of doing it. I think it's in here maybe, COVID. Oh, maybe I deleted it. I had one a couple weeks ago, I apologize. But you literally, right here, you can download the template just like we did off the website. So I'll just download the resident capacity one. And here it is. And when you're finished with it, you save it to your file. And on the day that you upload, you come click it right here upload it, go find where you saved it, click upload CSV, and it's done. And it will show up on the calendar as well, if it was complete or not complete. So it's just two ways depending on your personal preference. The other option you have is you can export too. If you want to export some data that you already have uploaded, maybe your facility wants to do some analysis, you can export it. And these are just mocked up numbers. And you can see 6.1 where I added those fake numbers just a few minutes ago into this pathway. So you can look at the data that you've already put in this way, and again, maybe do some analysis, maybe double check your numbers for data quality. Just some options for you. Does that help seeing it?
Yes.
Good.
So Tom, this is Pam. If you wanted to enter like a week's worth of data at once, wouldn't that be the easiest way to upload the CSV?
For me personally, it would be, because I could, at the beginning of my week, I could download all the templates for each one of the pathways, just check all here, download all 4 of them, and then I could start keeping track of my counts on the CSV file. And then when the time to enter the data next week comes, I simply say upload CSV. I go to that file that I've saved and remember where it is with the, and just click upload, and you're done. And then you start then while you're out here, you download some new templates and start your counts from that time to the next week. So for me personally, a person that likes to work in Excel, this would work really well for me. But some folks would prefer to come in daily or maybe every couple days and do it this other way. I don't see that there's a wrong answer.
So Tom, this is Pam. Since June 1st is not over yet, I would assume there's 2 more modules you have to fill out, right? Supplies and staff.
Right.
So that's why it doesn't come up on the alerts yet, because it's still June 1st. If we had the same data on the 31st and it only had resident and ventilator, I wonder if those record incomplete would come up for the staff and the supplies.
I wonder if it'll.
You should be able to go
enter date?
backwards.
Yeah, I should be able to go backwards. Let's try it. I want to put a bunch of zeros in here because I'm cautiously optimistic that this will eventually end. So maybe it'd be good karma if I did that. So it shows complete for resident. Huh. Maybe it just takes time to process that. Because you'd think it'd say incomplete. Well, let's do an incomplete one. Staff and personnel. Let's leave this one blank. And no, yes, yes. Okay, it saved it successfully, but you see that the staff one is a tan color, which means I didn't finish it. It's incomplete. So let's see if it gives us an alert here. Nope, it didn't yet. It must just take a little time to process that, Pam.
Yeah, I'm thinking you log out, and if you came back in, it would show up. So.
Well, we could do that. We could talk about other things while I do that.
No, I'm doing, you guys, I'm just asking questions. You guys go ahead and do what you had planned.
Yeah, if anybody else listening has questions, please ask them. We'll do our best to get you some answers. And again, most of you that are, if you've enrolled your facility for only the COVID-19 module, this whole login process will look different for you. You won't have a grid card for one. You won't. It's just a couple extra steps that I have to do, and some of the screens will look different as well. So. And then we'll go. I fat fingered that last one. I know I did. Darn it. Anybody else have trouble typing when everybody's watching? Okay, we'll try again. We'll see what that looks like. Let's see, this is the test facility. No action items, COVID. Alerts. No, it didn't show that time.
Yeah, I don't know, but it's very visual on the calendar. You can see what you have inputted and what's incomplete. So that's helpful.
Right. It is. It is. And again, if you do upload the CSV and you've completed, you will get the green on the calendar again. It worked for me once before, so again, just personal preference. A couple different ways of uploading your data. The important thing to remember when uploading data, of course, is they highly recommend to select the same time on the day that you're going to upload it. So if you're going to upload it weekly, pick a time like 8:30 a.m. Monday morning, and you will upload the counts effective from your last upload until 8:30 a.m. and then you will start your counts over again from that point to the next week, and only upload those next Monday at 8:30, for instance. So just avoid duplication. Are there any other questions or comments? Anything somebody wants to discuss that they might be having problems with, or maybe offer a tip? I'll leave the time to you all.
Tom, I'd put a question out there asking folks their frequency of reporting, if it was daily or weekly. And several folks have said that they do it weekly. And there was a comment that they were wondering maybe if daily might be better. But I think that's just a personal choice. You just have to, at a minimum, report weekly, right?
That's my understanding. You have to do it at least weekly, and in the documentation I've seen, daily's good. Maybe every other day is good. The important thing to remember again is to not duplicate your counts. Remember, okay, this is the cutoff for this time period, this day or this week, and then next week or tomorrow we have a different set of counts. So that's the big thing, is at least weekly, and don't duplicate your counts. So that all the information I've read stresses those two things. So.
Thanks, Tom.
You bet.
And Tom, can you open up the two other modules just so we see what they look like again?
The two other, oh, you mean these?
Yeah, just, oh, the supplies.
Okay.
The
Oh, okay,
staff.
sure.
Yeah, just
Obviously.
pop through those.
Yeah, so we have the resident impact and facility, and then staff and personal impact. Again, you saw me, there's a number of yes and no questions in that. Supplies and personal protective equipment. This is mostly yes and no, just asking if you have enough masks, surgical masks, etc. And ventilator. And of course, not everybody's going to have a ventilator, and if you don't have one, you answer no and you're done. So those are the 4 pathways, they call them, that go into the module.
Okay. And so once those are all completed, all those are done for that day or for that week, then the CDC team picks it up and then pushes it forward and reports it out to CMS?
That's my, yeah, they're the ones that have access to all of the data right now. And I'm sure they're using it for, just to keep counts. State entities are also, I think, getting access to this, if I'm not mistaken. So yeah, it's all about the data when it comes to medical stuff, and especially something like this that's we heard the word a lot, unprecedented. So it is interesting to know, just what exactly is going on with the pandemic. So yes, it goes into NHSN, that's a CDC controlled environment. They work with CMS and then other entities at the state level, and also are I believe, getting this data.
Thanks, Tom.
You bet. Any other questions or comments or? Well, hopefully you found this useful. We're going to plan on meeting again next week, same time, same place. So if you're having questions or other issues with it, with the COVID-19 module, please bring those, and we'll hopefully be able to help you out with those. But that's all I had for today.
Thank you, Tom. Very helpful.
Thanks, Tom. Bye, everybody.
Bye.
See you next week.
You bet.